Walter Uriek-Woon. I work with the Gulu Regional Referral Hospital as the Principal Hospital Administrator.
My name is Sadong Caroline Kefas. I am the ENT surgeon of Gulu Regional Referral Hospital.
Gulu Regional Referral Hospital started as a health center way back in 1934, and over time kept on upgrading Health Center 4 to a general hospital.
This being a regional referral hospital, we receive patients across the region. Basically here in accident and emergency, most of the cases we get are related to accidents.
In terms of service delivery, we have been able to really do a lot in the sub-region of Acholi and the Uganda at large. Not all our patients are coming from Acholi sub-region.
In the ENT department, we receive a wide range of patients who come with ear conditions, nose conditions, throat conditions.
Oxygen, we are generating ourselves here and distribute to all other regions.
I'm a medical officer. I'm working at the Department of Pediatrics and Child Health. A rough estimate of children that we see in a month is roughly between 60 to 80.
We've been able to reduce on maternal child health greatly. We've been able to contain outbreaks like we've had Ebola, we've had the COVID-19, we've had the Mpox. The cases that cannot be handled at those levels of the lower facilities, you say general hospital and below, we have them received here. For example, CT scan services.
We have quite a series of achievements that we have attained from government, and we are really quite appreciative. It's giving us the manpower, the likes of ourselves. Security-wise, we are guaranteed. We are quite okay.
And also would want to thank the government for the medicine that it is providing for the population that cannot afford. At least when the cycles come, it is well covered.
Government is able to give us the staff, the critical staff we need, and government is able to pay utilities and also pay salaries for this staff. The economy has improved, systems are in place.
As a committed civil servant, we shall always do our best and adhere to the rules and regulations the government has set.
you people, DCCU, move deep and out. Let the world know what is happening. I want to thank you very much for this initiative. Please go on. It is not that you are promoting or campaigning for the president of Uganda, Kaguta Museveni. We are showing the world what Uganda is. Please go ahead, and whether it is Musevenomics, those who hate it, let them hate it, but let us know Uganda. If you feel Uganda is not a good place for you, leave it for us for appreciating it. I thank you so much.
You remain as well?
I remain Walter Uriek Woon, the Principal Hospital Administrator, Gulu Regional Hospital.
DCCU, Uganda, digital content creators from OWC. Our mandate is to sell the ideology of President Museveni that he came with since 1986 to change Uganda into a better country in all aspects of life, social, economic, and political. I would like to request you introduce yourself to the position and the role at the hospital.
Thank you, DCCU, marketeers. Yes. Go viral, Musevenomics? Okay. I am Walter Uriekuun. I work with the Gulu Regional Referral Hospital as the principal hospital administrator. You are welcome to Gulu Regional Referral Hospital. And since we serve the whole Acholi sub-region, I want to welcome you to Acholi sub-region, which covers 8 districts and 1 city. You're welcome.
Do you mind mentioning those districts?
We have the districts of Pader, Lamour, Kitgum, Omoro, Gulu. There's a Gulu district and there's a Gulu city. Yes. And then we have the districts of Amuru, Noya. Have I forgotten another?
No.
But there are 8 districts in Acholi sub-region and 1 city called Gulu City. So you're welcome. And the Gulu Regional Referral Hospital serves all the 8 districts in terms of medical care, advisory, and the interventions. And more so that we have this proximity with the Sudan through Elegu, with the Nimule border, Elegu border. We have quite a number of sensitive approaches to have when it comes to surveillance and outbreaks. Others are welcome. In the hospital of Gulu Regional Referral Hospital, we have a number of services offered here. And I think I'll give you a brochure to that effect. Yeah.
So, in the matters of service delivery, how do you rank Gulu Regional Referral Hospital?
In the matters of service delivery, Gulu Regional Referral Hospital, like other regional referral hospitals, is supposed to be having 1,195 staff as per the new staffing norm. Right now we have about 350 staff members, and of course the number is still growing. We have more people coming in. In terms of service delivery, we have been able to really do a lot in the sub-region of Acholi and the Uganda at large. Why Uganda at large is because not all our patients are coming from Acholi sub-region. We have patients who are coming all the way from Arua for services here. Nebi. You have Sudan. They come here. So all these, we cannot limit them to Acholi sub-region alone. We've been able to reduce on maternal child health greatly. The people of Acholi are happy for that. We've been able to contain outbreaks. Like we've had Ebola, we've had the COVID-19, we've had the Mpox. As a regional referral hospital, we're able to contain this. And the Acholi sub-region per se is proud of the hospital being here. And of course, this we're saying we're able to contain is because of the government. Government is able to give us the drugs we need. Government is able to give us the staff, the critical staff we need. And government is able to pay utilities and also pay salaries for these staff members who are here. So, in summary, Gulu Regional Referral Hospital is well situated and the capacity is too big. In a year, we serve over 10,000 people.
So, I'd like also to know a brief background of Gulu Regional Referral Hospital. Since by the coming of President Museveni, Uganda had only 49 hospitals, referrals. But right now, Uganda has 156. So what is the background of this Gulu Referral Hospital?
Wow, that's a very interesting one. Gulu Regional Referral Hospital started as a health center way back in 1934. And over time, kept on upgrading health center 4 to a general hospital. And that's why you hear some people saying the medical superintendents here. And in 1999, it was upgraded to a regional referral hospital. That's where we are. So we are so proud that this has moved in all these stages and phases, and we're optimistic that we may have a national referral hospital status with time. We're optimistic of that. And of course, like you said, Uganda has quite a number. Regional referral hospitals alone were about 17. General hospitals alone were about 140 something. I'm yet to get that number. And then added with the National Referral Hospital. The health system per se is well thought. The implementation bit of it is where the challenge is, which is being calculatively managed. And we're optimistic that in the years to come, we shall have a very efficient health system, efficient and effective health system in Uganda. Yeah.
So if we know Gulu has been covered with instabilities, with wars, and even the picture outside there, Gulu has a very bad picture in terms of peace and security. But evidently, when we come to Gulu, we find a different story. So what are those factors that has kept the health system in Gulu stable and moving forward?
I think the story of Gulu being unstable, insecure, were stories of long, and that was the time of that war. We are no longer in that war. And those who still spread the information and the propaganda that Gulu is unstable, seemingly might have not even known the direction of Gulu. Those who have come to Gulu, you can move in Gulu at any time. Very peaceful. Most streets have lights all through. You're able to see who is coming ahead of you at 3 a.m., at midnight, any time. And it is also a very clean and smart town.
Yeah, I know that.
Gulu has transformed into, I don't know how to describe it, a process that has outbeaten most districts and cities as per Gulu city. And this, of course, is attributed to one, government commitment to the region. Security has been very powerful in this region. One, they fought the Konyi War and the instabilities. Two, they have stabilized the region of Gulu. And the three, I don't think there'll be such instability in Gulu in the near future. The people in Gulu have simply appreciated Gulu, and they're saying it is time to work. No more noise making. You'll hardly hear noise making in Gulu, people caucusing, we're going to demonstrate. We are here for work, and simply production. And something to note, Gulu seems to be a very big food basket that most people don't understand. It's a very fertile land. You can grow food crop anywhere it will grow, even without manure. That some people are using manure in some areas of Uganda. Gulu will grow that food without that. In other words, there's a lot of virgin land still in Gulu. And that also helps us in the hospitals because the non-communicable diseases are reduced at that level. And you find that we at this level of regional referral, we don't receive funny cases of malaria, diabetes, pressure. It goes down. And the health centers that are within the Acholi sub-region, we have 2 general hospitals, Anaka General Hospital and Kitgum General Hospital. These have also contained disease at those levels. And of course, we have the health center 4s, health center 3s, and then the 2s and the VHT system. So we are, as Gulu, we are good to go. And I want to thank the government for this. As a population in Acholi sub-region, we should really protect this jealously. Nobody should destabilize the system. We should only make it look better and improve on what we think is not going on well. Yeah.
So in terms of cases and Medicare, which are the common cases that you guys meet here at the referral that those general hospitals can't manage in the community?
The general hospitals have been empowered to manage most cases. There are cases of consultancy nature. And in Gulu Regional Hospital, we have 3 consultants, and there's one senior consultant who is a general practitioner and then internal medicine. So the cases that cannot be handled at those levels of the lower facilities, you say general hospital and below, we have them received here. For example, CT scan services are handled within the regional hospital. We don't have them in the general hospitals at lower facilities. And other specialized services that are here. And then the other thing that could be of importance is that the ambulance system is being controlled within here. The ambulance system of the region. You find we have 5 ambulances, but every district, every county seems to be having an ambulance. But the control system is within Gulu Regional Hospital, where we call, if an accident occurs in Anaka, for example, we're not going to take this ambulance to Anaka. We shall call Anaka, bring the patient here. 1, that saves on time. 2, it also saves on the life of the patient. In case of bleeding, you are not going to see a patient. You are going and coming. That distance you have used for going and coming back is critical in the life of a patient of that nature. So we simply call them to come to bring the patients here, and we handle them at that level. Here now, when the patient does not do well, our connection with the National Hospital takes over. But in most cases, like I said, are managed here. Yeah.
How big is this hospital?
Big in terms of capacity.
Big on the land, the wards, the sectors.
We are big. Actually, I want to take you through most of the facilities we have here. Most people don't understand or have not seen them. We are big to the extent, even oxygen, we are generating ourselves here and distribute to all other regions, our districts. And this one has somehow stretched us because we have Arua coming for oxygen here, Yumbe, Regional Hospital come for oxygen here. At times Soroti, in case theirs breaks down, they come here. So we supply all the facilities in Acholi and outside, oxygen. Yeah. And as we move around, you'll be able to appreciate some of these facilities. But we're big. Like I told you, we're 1,195 NOM in terms of staff. And we have so far about 400 staff members, still receiving new ones. And then the patient, the clientele is really huge. I will give you the data as we go there. And then we also have a staff building to accommodate 54 staff members in one building. It is almost at 80% completion. We have a doctor's quarters, we have a nurse's quarters. And of course the land has somehow been encroached on. Within us we also have the College of Health Sciences we're accommodating. We have Gulu University, Faculty of Medicine we're accommodating. We're also accommodating Uganda Police.
All that land belongs to us.
Yes, it is important to know that.
So how many acres do you guys cover?
We are proud to say here, internally here, we have about 6 acres internally here. Yeah.
So lastly, but not the least, outside the hospital, how do you see Uganda's transformation, like from 1986 and today? What defines Uganda before the coming of President Museveni, and today, what do you see that have changed totally and they are there for development? Due to the contribution of the leadership of the president.
That is very interesting. The transformation of Uganda has been really, to those of us who saw it from some level, and then patched up some history. I'm a born of 1980. But since then, we are moving forward. But when you look back to see where we came from, you realize that we are moving very fast. The economy has improved, systems are in place, and the infrastructure-wise, we are doing great. I've just told you about Gulu, how the roads are. If you take a picture and show somebody who has been in some corner of Uganda, they might ask you, is this part of Uganda? So we have grown in all sectors of life, security-wise, and then our lifespan. The life expectancy has also gone high. We really commend the leadership of this country. His Excellency the President, Musevenomics, and his team. They are doing great work. What we need to do is support them to do better than this. Because at times we want to move 5 steps ahead, but also have these voices pulling us 2 or 3 steps back. And that let us love the country we're in. There's no other country like Uganda. Even if you cross to Sudan, you'll never become a Sudanese. So love it, serve it, and make sure you leave it better than you got it. As simple as that.
Thank you very much. You can
Thank
give
you.
last remarks and reintroduce yourself.
I want to thank you, the team, and this initiative is a powerful initiative as a DCCU.
Yes,
Indeed, Uganda needs a lot of promotion. I've seen those who watch Premiership, I've seen a visit to Rwanda. I'm here to see, come and enjoy Uganda. We have made the president of Uganda become a promoter of Uganda. At times it makes me think we are not doing something better. The president is not going out to go and tell people, come invest in Uganda. And yet your initiative should have been the one making people see and know that, oh, there's something we need to go for. So I want to thank you for this initiative. It helps and it pushes us higher. There's no country, there's no part of this world, or even ourselves. If we don't talk about ourselves, nobody will talk positive about you. And yet we have a lot of very wonderful developments and initiatives going in Uganda. If, for example, not many people know that we make cars. Is it Kira? Kayola.
Kayola bus.
I was moving with the 2 people the other time, and I made this bus around Ginger. I said that is made in Uganda here. You guys are huge Uganda. This one in Uganda here? Are you sure? So we have a lot of ignorance about our own country. And these are people who are big people, prominent people.
Yes.
I moved to Karuma here. Behind Karuma. People can't understand what Karuma is. They imagine power just comes. But there's a whole magic in Karuma
And a lot of investment.
that nobody has told us. If I was not to move there, I couldn't even know. So you people, DCCU, move deep and out. Let the world know what is happening. I want to thank you very much for this initiative. Please go on. It is not that you are promoting or campaigning for the president of Uganda, Kaguta Museveni.
No, we are showing it.
You are showing the world what Uganda is. Please go ahead, and whether it is Musevenomics, those who hate it, let them hate it, but let us know Uganda. If you feel Uganda is not a good place for you, leave it for us who are appreciating it. I thank you so much.
You remain as well.
I remain Walter Uriakwun, the Principal Hospital Administrator, Gulu Hospital.
Thank you.
Thank you. God bless.
Thank you so much. My name is Adon Caroline Kefas. I am the ENT surgeon of Gulu Regional Referral Hospital. In the ENT department of Gulu Regional Referral Hospital, we receive a wide range of patients who come with ear conditions, nose conditions, throat conditions. We also receive referrals from the nearby lower facilities since we are a referral center. So we have patients who come in and we, like a day, they walk in and they go out. We manage their conditions as outpatient department. However, we also have patients who come in and they stay in the hospital. We manage them as inpatient. We also handle a wide range of emergencies. For example, patients who come and they have foreign bodies, for example, in the airways, or they have it in the nose, in the ears. We manage all that. The other services that we also handle, we also have procedures we do, for example, minor procedures. We have major theater procedures, like we do patients who have adenoid hypertrophy or tonsillar hypertrophy. We do for them surgeries like tonsillectomies, basically removing if you have a swollen tonsils in the mouth. We remove that, plus other surgeries which are in the ears, the nose, the throat, the neck. We also handle all those. So for anyone who have any conditions concerning the ears, the nose, the throat, or part of the neck, you're most welcome to Gulu Regional Referral Hospital. We'll be happy to serve you. Thank you.
You are most welcome to Gulu Regional Referral Hospital. Good afternoon.
Good afternoon, sir.
My name is Bruno Atiang. I am the Principal Psychiatry Clinical Officer, stroke the head of department. And this is one of the departments in the hospital which is concerned with handling people with various ranges of mental disorders, including alcohol and drug misuse disorders, which currently is on the increase. The unit has taken quite a couple of years now, but I was posted here last year in May to resume that leadership position. As I have told you, it is a mental health unit, and it is the only one of its kind in Acholi sub-region, which comprises of about 8 districts. When we include the city, then it's like 9 districts now. So that is the catchment area of the Regional Referral Hospital. So the mental health unit is the only unit of its kind in the whole of this sub-region. From here, we offer both what we call outpatient services and inpatient services to those ones who have mental health related problems. By outpatient services, we mean we see those ones who are not badly off or who were once managed from here and they have improved. They are now like taking their medication from home. So they could come on their respective appointment dates, then we review them, we refill for them their drugs, and then they go away. And then the other one is inpatient services. Those ones who are still badly off mentally, maybe who have just broken down mentally, or maybe who have been abusing substances excessively, like alcohol, marijuana, and many others. You know, those substances, they are capable of like disorganizing somebody mentally. So they then break down mentally, and they are brought here. So in that critical state, we do admit them here, and then we manage them on inpatient basis for quite some period of time, using a series of intervention, like using drugs. At some point, we even counsel them. There's some specialized form of counseling meant for them. And then we also do some bit of social support. And then we link them probably to some organization like Alcohol Anonymous Group and things like that. Then they go. So those are the services that we offer from here, inpatient services and outpatient services. Pertaining the ranges of mental health problem that we see from here, you know, people from outside, they know that there is only one form of mental disorder. But even if you look at them, the way they present themselves, you realize there are different types of mental disorders, okay? Different types of mental illness, including alcohol and drug misuse, including what ideally is not a mental condition, epilepsy, this illness which makes people fall down and then they begin jerking. From that side, it's called like that. So that one constitute about 50 to 65% of our daily OPD attendance, that epilepsy. And it's quite rampant in this region here. There are very many. Ideally, it is not a mental disorder. It is a neurological disorder. But because it presents with some mental signs and symptoms like mental confusion, seeing images of things, what we call hallucinations and things like that, those other general practitioners, they have like limited knowledge in that. So they tend to push them this side, and we are the ones who manage them from here. So those are the ranges of conditions that we handle from here. Ours is like a general thing. It cuts across from children up to adult. We all handle them here, especially when they develop any mental health related problems. On a daily basis, we see an average of about 50 to around 80 patients on a daily basis. Per month, our total coverage ranges. Some months it goes a little high, some months it goes down a bit. And these people have even good network. If they realize that there is no drugs in the hospital, then they don't come. They don't come many in number. But if they have known that drugs is there, the drug is available, you find them, you know, pumping in huge numbers. So it ranges from around 650 there to around 900 something in a month. That is our coverage, including the inpatient. The hospital, the unit has a capacity of 42 beds. Males, 21, and then ladies also 21, making a total capacity of 42 beds. And sometimes that capacity, we end up admitting patients even beyond that capacity. It depends on the season. But as I talk now, we have about 30-something patients in the ward. So they are not all that quite many as yet. I think around 31, but we even discharged some few. So that is pertaining our coverage from here. We are really grateful, especially to government through the Ministry of Health. You know, this unit was constructed, I think, over 20 years back. And you know, being a mental unit, it was in a sorry state. It was already dilapidated. But the ministry has helped us. Last year, the unit was renovated. I could say fully renovated. That's why you see the whole wall shining. We have new doors. It was fully renovated, and we are really grateful for that through the Ministry of Health. I know it is government which does it through that line ministry. We are really grateful for that. The other thing that government has done, which has really pleased us or impressed us so much, is giving us the manpower, the likes of ourselves. The unit is supposed to be headed by a psychiatrist, but many of such people are not there yet. So for the meantime, it is being headed by principal psychiatric clinic officer, like the one talking to you now. And then we are supposed to have 3 senior psychiatric clinic officers. For us, ours is covered. We have all the 3 and 1 principal. We are supposed to have 4 junior psychiatric clinic officers. We have 2. And we are supposed to have nursing officer, psychiatric nursing officer. We have 1. It's supposed to be 1 also. That one is covered. And then we are supposed to have what we call assistant nursing officer, psychiatric. They are supposed to be 4. Currently, we have 2 of them, which is not all that bad. And then we are supposed to have 8 enrolled psychiatric nurses. We have 4 of them, which is not all that bad. And we have a specialized cadre of mental health workers, which is found only in Butabika and perhaps here. A group of mental health workers called mental attendants. So Gulu Regional Referral Hospital has 10 mental attendants. So in terms of manpower, we are relatively okay. We are not all that badly off.
Thank you.
Yeah, we are pushing on, and we are grateful for it because that is an achievement that government has made us to get. Yeah, so that is great. The other thing that we are really grateful about is the supplies of drugs and other things. Government is doing their best to supply us drugs. Though there is that budget constraint, but at least they are doing their best. Our drugs are always there. If it is going to get out of stock, it doesn't take so long, just for a short while, and then you realize the next consignment has come. So we are really progressing so well in terms of drugs. But for now, we are not doing all that well because our drugs has been here for like about 3 months ago without any issue of drug stockage. Now we are expecting the next consignment of drugs to come. Now that it has not yet come, we have started experiencing that kind of drug out stockage. Some drugs are now out of stock, but at least it has not been all that bad during the previous months. We are progressing on so well. The other thing that government has done to us, they have supplied us, they are now moving from this paperwork to digital kind of
advancement.
Yes. So they have taken us through some training on this, on the software, which we are supposed to use in managing our patients here. So they have taken us, they have conducted a series of training now, and they have now connected all these other departments in the hospital with the exception of only ours. Ours had not yet been wired, but now the wiring is done. The computers, you can see them. This one is yet brand new, was supplied, and it's not yet even connected. And they say they were going to do the connection today. So we have quite a series of achievements that we have attained from government, and we are really quite appreciative. We are really supportive of government. We really appreciate what government is doing for the sub-region. They are doing a great job. Beyond that, as you can see, we are now very peaceful. We are enjoying security. this is what used not to happen in Gulu. It was terrible, but at least we are now very peaceful. You can move. There are buses traveling to Kampala from midnight, from here up to Kampala and to and fro, peacefully without any problem. So security-wise, we are guaranteed. We are quite okay. We are safe actually. That is why you see us like doing our best here. So far that is what we have seen from government, and we are really grateful for that. And like if you go back there, you also send our appreciation to government. Yes, they're doing the. Yeah, I said my name's Bruno Atiang. I'm the principal psychiatric clinic officer, stroke the head of this department. Yes, I've taken like roughly about a year here. I was posted here last year in April, and then I reported in May. So we are doing our best to ensure that our clients are catered for, are well served, and they are happy. We even have a feedback kind of sharing of information. We have suggestion boxes there. Sometimes we go to radio station to deliver radio talk shows pertaining like mental health and the rest of it. So people are appreciating whatever we are doing from here. At least there is a high level of achievements. They're benefiting from the unit. They're quite happy. They're contented with whatever we are doing, and it makes us quite happy also. And in turn, we need to appreciate government for doing all that, because it is not our own effort. It is through government. That is why we are like enjoying this kind of services here. So we are grateful for that.
Thank you very much.
Yeah.
It has been a great time.
Yeah.
met you in your service delivery location, and I would like to know, you introduce yourself, your position, the department, plus what you do.
Thank you so much. I'm Dr. Mugony Paul Bicham. I'm a medical officer. I'm working in a department of pediatrics and child health. For this month, I'm rotating in acute care unit. While in acute care unit here is where we receive pediatric patients. We do basically stabilization of the patients. When we have stabilized the patients is when we transfer them to other units of the pediatric department. For people or children who are still okay and they meet a criteria of going to general pediatric ward, we transfer them there. And if we have neonates who meet the criteria for admission to neonatal intensive care unit, we also stabilize them from here and admit them to NICU. But also children who are being admitted to nutrition unit, we receive them through this unit, stabilize them, and after stabilizing, we transfer them to nutrition unit. And that's what we do basically in a acute care unit.
So far in your department, in a range of a month, how many children do you work upon every month, like in estimation?
Yes, a rough estimate of children that we see in a month is roughly between 60 to 80.
Yes.
Yes.
So which challenges do you meet, like in your service delivery?
The challenges that we meet are challenges of late referrals from the lower facilities. Yes, some patients come when they are critically ill, and we struggle to stabilize them, and a majority of them we have stabilized. Yes, other issues that we get are sometimes the means of transport that they have used for transferring a very critically ill patient. In most cases are not the proper means, but through our mortality reviews, we have tried to identify such facilities and given them a feedback, and we hope for the best that there will be an improvement. There also at times a certain group of people in times that we do not have drugs in the hospital and then they can't afford to buy, it has been always a challenge to pull out such patients. You have human resource around, you have identified the problem, you want to start the treatment, but sometimes it becomes hard.
Okay.
Yes.
In your last remarks, you can tell us how has the government helped you guys in service delivery of health sector, and maybe you tell us what is your recommendation towards this.
First of all, I would want to begin by appreciating the government so much. To begin with, the infrastructure that he has given us has been good. It helps us in work serving on our patients, but also the infrastructure is not alone. There's at least human resource on the ground, though the number is not to the standards as you Ministry of Public Health released, but at least there's human resource that is able to work on our patients once they reach. And also would want to thank the government for the medicine that it is providing for the population that cannot afford. At least when the cycles come, it is well covered. Yes, then the other thing is the trainings that go on. I would want to appreciate the Ministry of Health. They usually have trainings that keep on going on, and that's very good. It motivates members. Yes. The recommendations I would still give the government is that where resources allow, more human resource can be brought on the board. For example, like Gulu Regional Referral Hospital being the center of excellence in Acholi sub-region, we would be happy if we receive all the super specialization in the region. Yes.
You remain as who?
I remain as Dr. Mugony Paul Bicham, a medical officer. Thank you.
Thank you very much. Hello.
Hello.
Okay. Yeah, good evening, madam. My name is Musevenomics. I would like you to introduce yourself, your position in the work you do.
Okay, my name is Bahati Mary Gloria. I work at this facility, Gulu Regional Referral Hospital, and I am the in charge of accident and emergency. Yeah.
So, what is the history or experience of your working here? Where did you find this hospital and how is it now?
Okay, thank you very much. I first worked at Moyo General Hospital before I was transferred to Gulu Regional Referral Hospital. That is in the year 2021. And by that time when we came, we found the administration block is the current library. That was where the director at that time was sitting. And then nevertheless, within this period, the administration block, as you see up now, was built, and also this building where I sit in. So there has been a lot of transit from the previous one to this time.
Okay.
Yeah.
The services you give out to the community?
Yeah, the services we give out to the community is this being a regional referral hospital, we receive patients across the region, okay? There are patients who come, and basically here in accident and emergency, most of the cases we get are related to accidents, but also we get those other conditions which have been filled from, being managed from lower health facilities. They refer them here because this is a bigger facility, and we give them those services. And also sometimes we go down to the lower facilities for support supervision. Yeah.
What do you think about the role of government in health sector like this one?
Okay, the role of the government in the facility as a health worker or a civil servant. For us, we are not supposed to take part in the in politics. For us, we are neutral. Okay.
I mean the drugs, the operational tools. Okay, what you use in the hospital, you have them? Does the government always bring them to you?
Yeah, we get our supplies from usual national medical stores. Mm-hmm. Yes, most of the supplies we get from them. But as I told you, this being a regional referral hospital, we attract very many patients, and you find that, yes, drugs are brought, okay? Every quarter it is brought. But then the quantity compared to the number of patients who come is always not enough. Okay. Otherwise, we appreciate, but yeah, they deliver.
Okay, your last remarks, and you introduce yourself.
Yeah, once again, my name is Bahati Mary Gloria. Yeah, I'm the in charge of accident and emergency at Gulu Regional Referral Hospital. And my last remark is, as a committed civil servant, we shall always do our best and adhere to the rules and regulations of the government has set. Thank you.
Thank you very much, Kat.
Okay.
You see how
Yes, I am Okech Francis Ouma, Senior Anesthetic Officer, Gulu Regional Referral Hospital. This is the